third-party booking, and it's one of the components whether it's a referral or whether you're doing in-office promotions. There's three different ways of booking a patient, a third-party patient. In other words, when you get a potential patient, one of your patient gives you a lead for a potential patient, their family member. Remember, we're focusing on circle of influence, where there's high trust, high awareness, and the person is emotionally engaged and involved and cares about that person, so they're willing to do a little bit more. When it's outside the circle of influence, they are not. And so you have to, we'll go into this in specifically, but I wanted to be real clear about the difference here. And there's three ways of booking a patient. There's three ways. And there's what's called a third-party book, there's a phone call, and there's a mailing. So those are essentially the three key ways. Now, you do have to have, or you do want some interaction if possible, but let me go over the third-party book. So the third-party book is, and you can only do a third-party booking if it's a circle of influence. In other words, this person is emotionally tied to who they're going to refer in. You cannot do a third-party book if the person that they told you about that they want to refer in is outside of their circle of influence. And there's many reasons why, but the number one reason why is emotional content. The person doesn't care as much. The further we get away from our core, the less emotionally engaged we are and willing to do things for people. Let's face it, we'll do a lot more for our spouse and our kids than somebody we just met on the street yesterday. Those are very different circle of influences and how much we're willing to do. So the circle of influence is typically defined as the high emotional content, and it's typically the people under the same roof, mother, father, brother, sister, and the first line of siblings. The first line of siblings, so maybe it's a brother, sister, mother, father that doesn't live under the same roof, but it's the first line. In other words, it's the first relatives. That's called the circle. And then another characteristic, so it's high emotional content. If it's under the same roof, you have a much, much greater chance of doing a third-party book than somebody who is maybe a sister or brother but doesn't live under the same roof. It's still high, but obviously you're going to have more if they're under the same roof because they communicate or see each other much more, and there's a much higher awareness. Now, obviously, these are generalizations. But they're very high probable generalizations. So that's called a third-party book, and those would be the factors. So if it's somebody outside of the circle of influence, you cannot do a third-party book. You have to do a phone call or a mailing. And here's what a third-party book is when you're going to ask this person to bring this person in with them the next time they come in. Now, I gotta say a caveat right here. We have not covered educational sales yet. Remember, there's three main categories to motivate somebody to come in. One is establishing the need, and one is dealing with the obstacles of time or money, and then there's trust. Well, if we're in the circle of influence, we're already in the high trust category. So we've already taken care of one out of the three. And then the offer will address the obstacles of time or money. That takes care of two out of the three. Now, educational sales helps to establish need, which takes care of three out of the three. Now, we haven't covered educational sales yet, so I just want you to be aware. So right now, we're sticking with the trust. We're sticking with the minimizing the barrier to entry of obstacles of time or money. And on the opportunity scale, remember on the opportunity scale, our likelihood is getting people who have a gateway that might be a 5, 6, or 7. If they're a 1, 2, 3, or 4, as well as their perceived need, it's going to be much less likely, especially if you have not established need. If you haven't taken that 3 and made it a 5, or the 4 and made it a 6. Okay, so we're already assuming that they're not looking for a chiropractor, but they have a problem, and we're lowering the barrier to entry. So having said that, now we will be covering that. We'll be covering the educational sales of how to establish the need, in addition to go into the trust category, in addition to eliminating the obstacles of time or money. The absolute core of motivation and getting them to act. Those are the three core components. So when we do third-party trust right now, all we're doing is we've targeted the trust category, circle of influence, and we've targeted the obstacle category, which was the offers with the bonus. So that's where we're at. Now, we want to do a third-party book, and essentially what we're going to ask this person who gave us the name is, remember, we're always going to get what's the relationship, what's the person's name, what's the relationship, and what's the condition. So those are the three core components as of now. Now, we'll cover a little more into that when we go into educational sales. But for now, when we do a third-party book, I'm going to ask this person, do you mind bringing that person in, whoever they gave you, their name, do you mind bringing that person in when you come in on the next visit? And here is why. You always have to say why. If you don't give why, nobody does anything. So you always have to say why. And this is what it would sound like. So if I'm talking to a patient, let's say this patient's name is Mary, and Mary gave me her brother's name who's having a problem. And she sees her brother regularly. He's not in the same house, but she sees him or talks to him every other day or 2 or 3 days. So there's the emotional content there. And so I would say, hey, Mary, and remember, I'm not doing any educational sales yet. I'm just talking about a third-party book. So I'm going to say, Mary, and so Mary's the patient. And let's say her brother's name is John. So I'm going to say, Mary, can you do me a favor? And I'm going to ask you a favor. Can you do me a favor with John? And you know how sometimes, a lot of times, if we're not comfortable going someplace we've never been before, you know how, have you ever felt that before? Like if you go somewhere new and you don't want to go by yourself, or it's uncomfortable because you've never been there before. So can you do me a favor, and can you just make a tentative appointment with John and bring him in with you on your next regularly scheduled visit? And the reason why is, a lot of times when people haven't, number one, if they haven't been to a chiropractor, they can be a little more uncomfortable because they don't know what's going on, and that's normal. Also, it's an unfamiliar place. He's never been here before. So it'd be a little more uncomfortable for John to come by himself. So would you mind just bringing him with you on your next scheduled visit? And on that particular visit, would you mind just changing your visit time period that matches John, so a time frame that he could come in? In other words, if he could come in earlier or later, could you just on that one visit just modify your schedule? Does that make sense, Mary? I'm sure you can relate to what I talked about of going somewhere that you haven't been, or seeing somebody that you don't know, how it can be a little bit more uncomfortable. I'm sure you can relate to that. So would you mind just tentatively, and we know that you can't make an appointment for him because you don't know his schedule, but what we'll do is we'll just make a tentative appointment, and then you just confirm it and bring him in with him, and it's fine. And if you can't for whatever reason, then just let me know and we can modify it accordingly. It's no problem. But if we can just make a tentative appointment and just have him come in with you the next time you come in, that would make John feel a lot more comfortable. Does that make sense, Mary? Would you be willing to do that for us, for John? That's what it would sound like. That's called a third-party book. You're going to get most of your patients in a third-party book, especially if you do it, like I said, and let them know why. Because that person can relate. Everybody has been somewhere by themselves in an unfamiliar place, dealing with unfamiliar people, and felt uncomfortable and maybe not even wanted to go. Everybody has, if they're of any age. So you have to explain it from the human side, and that's pretty much how it sounds. It's called a third-party book. Explain why. It's because a lot of times that person, we can feel a little more uncomfortable not going somewhere to maybe a provider we've never been or a place we've never been. And I'm going to get to agreement. Does that make sense? And that's probably happened to you before, Mary. So and also remember, they cannot make a definite appointment. The key word is tentative, because they can't. They don't know the person's schedule, all that stuff. And even if they did, they still have to get their okay. So if you go for an absolute, you're going to have a much more resistance. But if you say tentative and you acknowledge the scheduling, and then we ask this person to modify their schedule that fits this person's schedule, because that helps lower the barrier for this person. Remember, this person, your patient, already has trust in you. They'll be willing to modify their schedule a little bit because of their familiarity with you. This person will not give you much room because they don't know you and they don't trust you. So we have to go to accommodate this person and ask this person to modify because they do trust us. That's how. So the other key word is tentative. Make a tentative appointment. We understand that you can't be affirmative because you haven't talked to them, but we can schedule a tentative appointment. And for if any reason it doesn't work out, just let me know and we can modify it accordingly. And so now, will that work 100% of the time? No, nothing works 100% of the time. But it's high probability, especially when you get the agreement from the patient. So that's called a third party book. Now, the phone is when you actually get their phone number from that patient and you call them. We're going to go into that later, because when you make that call, you have to establish need before you make the offer. And we haven't talked about establishing need yet. That's called educational sales. And the same if it's a direct mail, in other words, you're going to do a mailer with the offer to that person, then that's fine too. And typically what we did is all three. We went for the third party book. We went for the phone call first. That's what we went for first. And we had that person call from our office right there and then hand the phone to us. That's what our marketing assistant did first in the referral program. First was call live, establish need. First, there's third party trust because it's your patient that makes the phone call. And essentially she says, this is so-and-so. Hey, do you mind speaking? My doctor wanted to talk to you. Do you mind speaking to him for just a minute? And all you do is go through educational sales, establish need, make the offer, minimize, and you book them. And that's taught. So that's the first thing. The second thing is what's called a third-party book. And the third thing is the mailer. So that's the three ways of communicating with them and the priority of mailing them. Now, for this particular promotion, we have not covered educational sales. So I would suggest strongly you put a lot of focus in on third-party booking. And that's the language of a third-party book.